we're today we're acknowledging or kind of recognizing the fact that Access Family Care has officially been around for 20 years. Mary Ann started to tell us that the beginning happened, actually it goes back a little bit further than that. Of course, that's the planning stage and everything. So Mary Ann, tell us, why did this thing come about? What happened? Jerry, Mary Ann, what started this
George
thing?
Thomas from the Missouri Department of Health came down and he said, I want to make an announcement. So he got up and talked about these new clinics that were coming on, and he said, I've got to have 3. And he said, McDonald County will be the lead clinic because they have the requirements that the state of Missouri and the federal government require. And he said, we want you to work and get started. As soon as I left the clinic, I zipped back home and I saw the county court. And I said, hey, I want to tell you about something. So I told them, and they said, well, let us talk to 2 or 3. And they saw people that came in and they talked to him about it. And he said, yeah, we want it. So I worked like the Dickens for 21 years. I really did. I really worked it that year getting it started, but I've enjoyed it and I love it still. If I didn't, I wouldn't be here today.
So Jerry, how did you get hooked into that?
At the time, they were going to use the 3 counties, and we
Newton
wanted,
and Berry.
and we was going to use the health departments, because at that point in time, health departments didn't really all have doctors on staff, and so we knew we had to find a way to work with a clinic that we would have access to a doctor, and so we was doing that, and it was us 3 counties, plus we had
We had,
migrant workers.
yeah,
Yeah.
where you were.
Yeah.
Luann Honeycutt, I think, was.
Lou Ellen Honeycutt.
Lou Ellen, that's
Yes,
right.
Lou Ellen Honeycutt was,
Right.
And
Mhm.
and then Pat Tishner, she was the administrator for the health department in Berry County at the
right.
time.
Uh-huh.
And so you all are the founding mothers, started this thing off. So what were you thinking? What was your vision? What did you see starting out?
I could see it being used a lot.
You know?
And I didn't dream as much as it has been.
The
Yeah.
first clinic was in Pineville, is that right?
Right.
And you weren't even open every day at the time when
No,
it started?
not with this clinic.
A rented, I see, it was a rented house down in
Yes.
Pineville under some
But
trees.
But first there was a small building upstairs, that was upstairs there in Pineville, which is a small place. I hate to tell you, we'd gotten lost, but you couldn't. But anyway, yeah. And then my husband and I bought that rented house, and then I knew when we were trying to find some place and couldn't, and everybody in the sun was coming and wanted to rent us places, he got one of his friends to buy it from us, because I know legally, since I was president of this, that I couldn't rent it to anyone. I wasn't going to do that and get in trouble.
So it took some community participation to make
It sure
that
did.
happen.
Yeah.
And so what was it like when you got your first doctor in there and started seeing patients? What did that feel like?
Well, we got some physicians that just wanted a day or 2 in a week, and we used them. And I hate to tell you, but I held the very first clinic. I did the big blood pressure clinic for them.
Oh, that's awesome. Well, I can imagine that.
Yeah, I did.
So Jerry, I remember those trips early on in the board. We would ride together down to those early formation meetings. George would be there.
Right.
In different ones. So tell us about how all that went.
I don't recall very much about it. I do know that we made several trips up to Kansas City to meet with the state too, to make sure we had everything going. And we did a lot of,
He was federal.
Bedville,
He was federal.
but he was at,
Yeah, he was in Kansas City.
Yeah,
Right.
HRSA folks.
yeah.
Yeah.
And then we spent a long period of time just writing all the rules and getting everything together. That took a long time to do that,
Yeah.
to get approved, to even get it.
Yeah, who was the first one that you hired? Was that a CEO at the time, executive director, or was that the first?
Robert
person?
Walter.
And that was he was the first employee,
hmm
and then things took off.
And I thought, boy, I'm going to kind of take it easy, because see, they wouldn't let anybody, the state of Missouri sent the funding that I billed for and everything, and I thought, well, I won't have to do all this. And he refused to do it because he said, I want to be sure that you're audited first, that you haven't made off with the money. And I hated to tell him I hadn't.
There was probably no money to make off with that.
Yeah.
That's right.
So you started in Pineville, and at the time it was supposed to serve three counties.
Yeah, we moved around and had our meetings in different counties
And-
for a
and then
while too.
I think that you had some transportation. You got a van, and you were actually transporting patients in
Wow.
from the other counties.
Yeah.
Is that right?
That's right.
So those were the. Did you ever envision? What? That's what I really want to hear. What you envisioned at the time? Did you just see it being one clinic, or did you see, well, we'll have a clinic in each county, or what?
Well,
were
we
you-
had a clinic in each of
Eventually, you did.
the three counties eventually, but Newton County didn't want us at that time
Yeah.
to hold meetings or anything. You know, their board president was against it. What was his name?
Dr. Porter.
Yeah, Dr.
Yeah.
Porter.
So the ironic thing about that is
We
we
bought
actually
it.
have a clinic where he had
Yeah,
his
we
practice.
bought his
Yeah,
clinic.
I know. That's why
I remember when we did that. I
she
looked
got-
at you, you had the biggest smile on your face. I said, what is
Jerry
going
and I just
on?
died laughing as when you
Yeah.
I
bought
said,
that
Mary, what are
building.
you
Yeah.
smiling about? Then I got the story.
Yeah.
So there's a little resistance. In Newton
Oh.
County, the other thing, it's not it doesn't meet the criteria for a health,
Real well.
but the health disparity.
But Barry didn't either, but they didn't pay attention to that.
Oh,
They helped, all
yeah, they
three
did.
of them,
They really
you
did.
know.
Worked really
Uh-huh.
hard.
Yeah.
So does anybody else have any questions you'd like to ask? 'Cause
I guess they could ask me, what am I doing here now?
we know
No.
why.
But you have a lot of the history written down.
I do.
Yeah.
Uh-huh.
So,
Yeah, all the different clinics and the grants that we
Mhm.
obtained throughout the years so we could open up the clinic. So after Pineville,
they,
what came next? Did you move it to Anderson and then?
I don't know about the.
Yeah, well, we were already kind of spread out, and I knew we had to get rid of the Pineville Clinic, so, as I say, we had already sold it to a man,
Mhm.
so he had it. But anyway, we met at the three clinics, you know, at different times, and had our meetings. But George Thomas said, you need to have all your board meetings here, in this clinic here in Pineville, because this is where it's all started. So I said, okay, so that's what we did.
And then eventually you moved to Anderson and you were located in
Yeah,
two different
Chris-
buildings there. You had the clinic on
Chris
Castle.
Castle was the one that got us to move to Anderson to build.
No, wait a minute, I think it was Linda
Yeah.
Odom.
Linda Oldham got us to move to Anderson?
Um,
Oh, yeah, that's right,
downtown.
she rented one.
Yeah, we're downtown.
Yeah.
You had the clinic on one side of the
I thought
tracks,
you were talking
administration
about
on the
the
other.
the
I remember we
building
had
they
to
built.
stop and wait for the train sometimes to cross over.
Oh,
The
yeah.
administration building wasn't much bigger than this
Did-
room.
oh, no.
wasn't
I
it?
know.
And they had desks like crazy.
Everybody was stacked in there.
Uh-huh.
So that was something.
Yeah.
And then finally got a grant, a federal grant
Chris Castle got,
for
to
the
build that
Anderson
building. Anderson
clinic where it
building.
is now.
Uh-huh.
And then Cassville came along somewhere in there.
They had a clinic as soon as we did, you
Okay.
know. I mean, before we built the building. See, we had a place rented to to see the people in the different locations. But anyway, but that was after we had been, well, I'll tell you, it was in 2004, was when we had the dedication of that new building.
So the original name, Ozark Tri-County Healthcare Consortium, so we decided somewhere along the line to change the name because we actually got out of 3 counties. We
That
spilled
was
out.
okay, yeah.
And so now we're in 6 counties and on the verge of adding another one. So did you ever think it would get like that?
I never did, but I hope for it.
Jerry, what do you think about all this?
I just, I think it's amazing how it's grown and expanded and just, meeting the needs because
But we
they are
had
there.
some good leaders, and you're one of them, Don, that's really helped a lot.
Well, I appreciate that, but I tell you, it's a great staff that we have here. Really
Yeah, I
hardworking
know.
and dedicated.
I
I
know,
mean, they are
but-
committed to the mission that you all established.
Yeah. Mhm.
So we appreciate your leadership and your direction, your commitment to this organization. 20 years.
Mhm.
And like Jerry said, she started when she was 15. right?
15, yes, I was.
That's
right. Well, Mary
I'm
Ann.
not gonna tell them how old I was when I got started.
Yeah.
Oh dear.
Anybody have any questions or comments?
I have a question. Where do you think we're gonna be in 20 years?
I don't know,
What do
but
you
I won't be
foresee
with you.
now?
She'll be in heaven.
Okay. What do you think the company will have done?
Well, I think you'll keep growing. I really do.
Yep.
As long as the money holds out from the feds and everything. Because I read today where Social Security's gonna really cut back on next year's income for the people.
They'll need us more than ever.
Yeah.
I know. I
Lots of
know.
struggles all the time. It's been a struggle.
I know.
All along the road. It's not been an easy 20 years, has it?
No,
But you've found a way to make it happen.
sure.
So that's amazing.
Yeah.
All right. No more questions? That was a good question, by the way, 20 years from now.
I wanted to know, that way in 20 years, we can go back and look at this.
You can go
We've
back.
gone
what?
another
You're gonna-
20 years and see if you predicted properly.
Oh, I see. Okay.
We bury it in a time capsule?
Yeah, we'll have to
Yeah, that's what we'll have to
to
do.
another building. So for everybody, if you want,
And I sure didn't know we were gonna do this evening.
I just want to show this. This is really nice. I appreciate Steve and
Yes.
his work making this happen. So if this is a real strong plastic, so if you drop it, you don't have to worry about it.
Oh,
It's not
good.
gonna. So it says Mary Ann Bradley, and of course Jerry's will say Jerry Wise, founding board member, 20 years service and advocacy for quality healthcare improvements for the underserved in Southwest Missouri. Mary Ann's leadership changed lives for the less fortunate in our region. Thank you both very much for a big commitment of your lives, for sure. There's a little-
Thank you.
I guess I'll go through that.
Yeah, we have to thank you.
Which is the last piece.
Is there anything else in here? Was that it? Joy's gone.
I believe it is.
So I'll take this to your
Okay.